besties. I just got my notification. I'm live. How is everybody doing this evening? It's great to see you all in the nest. Now, if you popped in, you're not sure what's happening in here, okay? We're not looking at Chantal. Yay! We're discussing something a little bit different. I had brought up, that I am a lady of, I'm 49 years old, okay? I'm 49. And, I've had a few things going on. And I thought, I just thought I was getting older. And it's like, okay, I guess this is what it is, right? Oops. Sorry. And come to find out, a lot of my symptoms were actually perimenopause. And there were symptoms that I didn't even know were tied to that. So I was kind of looking into it. I asked my doctor. Some of you know that, I went and asked, and she said, basically, there's nothing that can be done for it. You just have to deal with it, and we'll put you on an antidepressant. And I said, oh, I know that that's not the case. Like, there's more available, than just that. And, but she just didn't know. And she was like in her 30s. So she's not, and she, so she just basically graduated from medical school not too long ago. So it's not being taught widely, certainly not in primary care, and sometimes not even in OBGYN. So hormones are definitely real for sure. Yeah. Hey, Sloppy Oppy, how's it going? Yeah. Antidepressants, and certainly mood swings and irritability can be part of the hormone fluctuations, but that's not all. That is not all. So I thought I had asked you guys, like, have you guys ever tried this? I'm looking at this one thing. I kept getting an ad for something called Winona. And, I was a little skeptical, so I asked the nest, have you guys ever heard of this? And no one had ever used it before. And I said, okay, Well, I took the plunge. And I'm like, you know what? I don't even have a doctor around here who will address this for me. And I don't think that that's fair, because I feel, I'm a fairly knowledgeable person when I want to learn about something. And I feel that there are options, and why aren't they even being suggested to me? So I checked out Winona. There's other companies out there too. And, it is an online pharmacy. However, I have been more in touch with this doctor at Winona than I have with my own primary care in like a year. She initiates conversations with me. How's everything going? Answered all my questions. Yeah, Jennifer Lynn. Yeah. Yep, I'm using Winona. And they said, like, you might start to see a change, a difference, like within 8 weeks or so. Like, most women see a change after 8 weeks. So I went ahead and I went, I checked off all of my symptoms, like, yeah, this is what I'm going through. This is what I have. And I'm like, don't I have to have blood tests done or anything? Like, is this a real thing? Well, I learned so much. About it. Basically, over 10 years before we actually lose our periods entirely, your hormones are like slowing down and not being produced nearly as much for 10 years prior to that. So it's a gradual slowdown. You're already losing them. And when you are in perimenopause, which is, before you actually hit menopause, your hormones are fluctuating. So that's why it doesn't make sense for them to do lab tests, because at any given time, your levels could be different. So I guess they can do the lab test to confirm that you are actually in menopause, but not in the transition period before it. Yeah, so many people go through it in silence. Yeah. And some of the symptoms are a little embarrassing, and you just think it's, because you're getting a little bit older. Well, and I don't see any of my, like, I know women, a lot of women right around my age, and I'm like, Like sometimes we joke about stuff, but it's like, okay, are you doing anything about it? Cause so yeah. Yeah. So I have a bunch of stuff to share with you tonight. I sure do. And there are a couple of first of all, what am I doing here? We have new members. Soliata became an owlet today at 3 p.m. Welcome, Soliata. Welcome. Capone Boxer is back as an owlet. Welcome back, Capone Boxer. And Ms. Mac gifted 5 Are You Serious memberships. Everybody who's a member now, welcome. Welcome. That is awesome. I love the nest. Ms. Mac gifted 5 memberships. One of whom is a Tiefling Bard. I hope you're doing well, a Tiefling Bard. Baker Coffee Maker received one. Jocelyn's mom, WSU, got one. Nancy McCoy received one, and Christy received a 30-day membership for free. Yay! Awesome. You're getting ready for your date, Tiny Walnut? Oh my God. Be sure when you come back to tell us all about it. We want all the details. All of them. Every single gory detail. We want them all. You know how we do over here. We want the nitty-gritty details. We do. Okay. So let me bring up... We're going to start with, there is a physician, she has her own practice in Texas. Her name, you may already know who she is. Her name is Dr. Mary Claire Haver. And she spoke herself about being an OBGYN and not learning about it even. Crazy, huh? Like she had to put in the time to educate herself and listen to her patients and everything. I'm just trying to pull it up. One moment. One moment, please. But yeah, I figured we needed to talk, you know? We had to talk. We need a safe space. And the nest is safe, I think.
I'm going to be completely honest.
Oh, okay. All right, so this is Mary Claire Haver. And this is just like a little, like I guess she's mostly on TikTok. She's 55 years old. She is a board certified OBGYN. Here she is.
I'm going to be completely honest and call myself out here, and probably going to get some flack for it, but I'm just going to do it. So I'm a board certified obstetrician gynecologist. I've been practicing since residency finished in 2002. So after 4 years of medical school and another 4 years of training specifically in women's health, I became a general OBGYN physician. I was a great obstetrician. I was a really, really good gynecologist, but I have to be honest with you, I was a terrible menopause provider. My chief year of residency was when the Women's Health Initiative was released, and all meaningful education in menopause care stopped for about 20 years. It took years of clinical training. It took stepping outside of the box of what was presented to me by the boards that I was affiliated with. It took really listening to patients and absolutely believing them. I was taught that women were expected to be mad and sad once they were done with reproduction, that the only clinically relevant symptoms of menopause were hot flashes. And as painful as this is for me to come on here to admit, it's much more painful for you as a patient. Let me be clear. Menopause is so much more than the end of your periods, the end of reproduction, and a few bothersome hot flashes. as our sex hormones fluctuate and then decline, we see an acceleration of disease processes. Diseases such as atherosclerosis, hypertension, diabetes, insulin resistance, depression, anxiety, and musculoskeletal disorders. This is far beyond what is expected with aging. This is directly due to the decline in our sex hormones. We need a tremendous amount of research in this area because intervention will likely decrease risk. So little in women's health is focused on prevention of her particular disease risks. We can prevent osteoporosis. We can likely delay or prevent cardiovascular disease. We definitely can delay or prevent mental health changes. You absolutely can accept the status quo. You can be healthy without hormone therapy. I think every woman deserves an individualized treatment plan looking at her particular risks and benefits and allow her to make a decision what she thinks is best, as well as access to education and information so she can make informed health choices.
Okay. See what I'm saying? There's so many different symptoms that you wouldn't even necessarily know about. Unbelievable. And that's just the tip of the iceberg, believe me. So I'm putting links to everything. Actually, they should already be in the description. So, because I'm going to give you some resources that hopefully will be helpful. I've downloaded some things and I've actually sent some things to myself because I have access to clinical documentation that doctors use for reference. So I have brought that with me for the Nest discussion today. All right. Okay. So, all right. So this is just like some, quick little facts like, okay, what is it actually? The text on here is probably unreadable. However, I will give you the links to all this so you can find it yourself. Okay. Hey, everybody just coming in. Welcome. So I know this isn't the best text, but you'll get a link to this. So this is from the Endocrine Society. And this particular document is a patient resource. And so this says, and you can see it's endocrine, hormones, not necessarily OBGYN, right? So there's 3 stages to transition to menopause. And it's a biological part of aging process for all women. Every woman is going to go through it. Hair loss. Yeah, hair loss is definitely a thing. Yeah, for sure. Menopause can happen between 45 to 55 years of age in most women. It can start much earlier. So 3 stages. Perimenopause begins several years before a woman's last period. When the hormone levels begin to change, women may experience irregular, shorter or longer, heavier or lighter menstrual cycles than usual, and spacing between periods might change. Women may also experience hot flashes and other changes during this phase. Now, I haven't experienced many of those, and it seems like that's what doctors really want to address. Like, oh, we can provide relief from hot flashes. Well, if you've only had a couple, and if they don't really bother you, okay, but there's so many other benefits to treating it. So for many women, perimenopause can begin as early as 40, but on average, it starts around age 47. So I'm going to read, and menopause is the day that your period ceases after not having a period for 1 full year. Then you're considered to be in menopause. So this means you haven't had any bleeding at all, including spotting, for 12 months in a row, and that typically occurs around the age 51. Postmenopause, women enter postmenopause after menopause. Hormone levels remain low, and women are no longer able to get pregnant or have monthly cycles. Postmenopausal women are more vulnerable to heart disease and osteoporosis or thin bones. Early menopause can be a result of a surgical procedure, such as removal of both ovaries, chemotherapy, or radiation therapy for cancer. Early menopause could also result from autoimmune or genetic abnormalities. So, just some common symptoms. tiny walnut, you don't have to suffer. So if you're like, what? Okay, you don't have to suffer. I'm telling you, I'm going to tell you about my own experience. So some women sail through menopause with only a few symptoms, while others experience them all. And these can occur during any or all stages of menopause, from perimenopause to postmenopause. Irregular periods, hot flashes and night sweats, mood changes, sleep problems, vaginal and bladder problems, fatigue, heart palpitations, dry skin, joint aches, body changes, weight gain, hair thinning, forgetfulness, and changes in sexual desire. Crazy. Crazy. I didn't know joint pain was one of them. I just thought I was getting old, Crazy. So, they say, oh yeah, you don't have to do hormone replacement therapy, and you don't. You don't have to. They say eat a healthy diet, stop smoking if you smoke, get exercise, get calcium with D. For me, I already do all of these, and it's not helping. So that's why I looked into further things. So your diagnosis, if you've missed your period 3 months in a row, it's time to talk with your healthcare provider. I haven't missed one period, not even one. And I had an endometrial ablation, and I still get a monthly period. So, and the treatment, no matter how you experience symptoms or which ones you have, there are good ways to treat them, because you are unique, your symptoms will be unique, and treatment will be unique. Hormone replacement therapy may be right for you, and that's a decision you absolutely want to make with your doctor. So, there's that. Okay, and also, I'm going to give you a link for this. This is a symptom guide, and I got this from Winona, but I'm going to give you the link to download this if you're interested. It's free. It's just a PDF file, and it's a 78-page document on how changing hormones can cause menopause symptoms, and it goes over every symptom. I mean, it's crazy. And this was one that I really noticed, I think, first. Suddenly seeing a reflection of a tummy that looks unfamiliarly round becomes your new normal. So weight redistribution and gaining visceral fat in the belly area. I thankfully have had a fairly, not like super flat stomach. I don't have abs or anything, but it's like I would think that I was looking normal, and I would catch my reflection in a mirror and be like, what is that? What is that? And I didn't change. It's not like I started picking out. It's like I don't even think my weight really changed. Yeah. And I'm like, oh my, how do I even dress for this? I don't even know. And I really thought, I'm just stressed out. I was grieving the loss of one of my dogs. I'm like, I just have low energy. I'm probably not, as active as I think I am. Maybe I am eating more than normal, but it wasn't going away. Like once I was like, okay, I need to do something about this. It wasn't going away. And it was a different kind of fat. It's like, it wasn't just like I normally used to gain fat like on my hips and thighs. And that's pretty much stayed the same. So that's weird. And then like, it's not attractive for me. If you're not used to having belly fat, it's just like, how do I even dress for this? What do I do with this? And so that was concerning. But I'm like, well, I guess I'm getting a little older. And like, I just, I started a new position in my job, and like, I'm very focused on that. So it's like, I just got to move. I just got to like get over it. And, I got other things to focus on. In my 20s and 30s, I would have been panicked and probably looking for like, liposuction or something, but I'm over it now, So that was something that I was like, I don't even know what's going on here. Some women can feel overwhelmed by hot flashes and exhausted by heavy periods or interrupted sleep. Untreated menopause can serve up debilitating symptoms and severe side effects that can completely derail a woman's life and cause problems in her relationships. And if the drop in hormones isn't corrected, women are at a greater risk of heart attack, type 2 diabetes, dementia, some types of cancer, and even suicide. Tiny Walnut, I'm lucky for you guys. Over 80% of women in perimenopause will have far-reaching symptoms, including brain fog, anxiety, weight gain, low libido, depression, sleeplessness, exhaustion, headaches, stiff joints and muscles. But the good news is that they can achieve effective treatments. And you can do that anywhere. It doesn't have to be Winona. I just happen to be a patient. And so they sent me this, but I'm providing the link to you to download this if you do want to read it, because it goes over every single symptom. Electric shock feelings. Like, what? Hair changes. I started having to get up 3 times in the middle of the night to use the bathroom. And it's like I felt like I was waking up every 2 hours to go pee. And it's like I don't feel like I was drinking that much more fluid, if any more, at the night to be waking up that often to go. But I didn't even really think of it because, my mind is on other things. And every morning, I would say for the past 2 or 3 years, when I get out of bed in the morning, one of my ankles would just kind of be painful and a little bit stiff, and I used to be a runner. I used to run a lot. I've always been, I had an overuse injury once when I was younger. So I just figured, well, I'm paying for it now. I have arthritis in my ankle, I guess, right? And it wasn't debilitating. It wasn't oh my God, I got to take, it would eventually start to feel better as I warmed up and stretched and everything throughout the day. I didn't know that joint issues can also be part of this. So, very, very interesting. Trying to bring up a video for us. Okay. Okay, let me get this off the screen. How are we even looking at this right now? I just want to show you other stuff. But the link for this, if you want to download it, it's completely free. You don't have to be a patient. You don't have to, none of that. Yeah, you can check it out. Okay, let me just figure out what I'm doing here. Okay, there's that. Look at these owls. And you know what I tried to get was AI, middle-aged women or women of all ages, in a flowery field, like a tampon commercial or something. And AI was giving me the craziest stuff. I was like, excuse me. Excuse me. Weird looking stuff. Okay, so this is the medical director for Winona, and he talks about joint pain related to menopause.
Hi, my name is Dr. Michael Green. I'm the Chief Medical Officer of Winona, and today's hot topic is how is joint pain related to menopause? Joint pain is actually one of the common symptoms of menopause and the menopause transition, and hormone replacement therapy often helps joint pain quite a bit. There is a caveat to this. You get joint pain from arthritis, you can get joint pain from chronic injury, joint pain from overuse. There's a lot of reasons for joint pain, but one of those reasons is the menopause transition. So if you found that you never really had much joint pain and all of a sudden you're getting these symptoms of menopause and one of those symptoms is joint pain, it's very likely to be from the menopause transition, and in that case, hormone replacement therapy should help quite a bit.
Seven unusual symptoms
I'm going to be
Okay, I have a whole playlist lined up for us. It kept playing. Sorry about that. Oh, you had to cut your shopping short today because of joint pain? That sucks. Tiny Walnut? No, you're not in your... No, we're in the nest. It's all good. Have your feelings. Have your feelings. You appreciate an older male MD who acknowledges menopause? Oh my God, for sure. For sure. So let me see what else I have for us. I downloaded some stuff. I want to make sure I show it all to you. Oh, this is what I got from... This is a clinical... This is used by doctors. Let me show this to you. It is kind of clinical-ish. But I think the nest can handle it just fine. I do. I don't think we have any issues with that here. Let me make sure it's big enough so you can see it. Because some of us, we can't see as well as we used to. I was at Walmart the other day looking to buy a lipstick. Like, I love this one lipstick I have from e.l.f., but I wanted it in a different shade because I'm using it all the time. Well, I take it out of my purse to read the bottom of it to see what the shade is so I don't buy the same one. I could not read it for the life of me. I took out my phone. I tried to zoom in on it. I couldn't read it. I mean, oh my God. It's time for those, glasses. I do have some. I didn't have some with me, though. So this is a resource called Up to Date, and this is used by clinicians. This is from a medical. You have access to this if you can log into this, basically. So that gives you, an idea, maybe a little bit of what I do at work. So risks and benefits of menopausal hormone therapy. So the thing is, right, I've learned that if you start hormone replacement therapy, if you can, not everyone can, if you start it before the age of 60, it can reduce your risk of all kinds of things. It's amazing. So this is a number of females per 1,000 after 5 years of use. So this is for postmenopausal women aged 50 to 59 years of age. What's the E and the E plus P? Let's see. This figure plots these data, which are expressed here as excess risks and benefits per 1,000 females using hormone replacement therapy for 5 years. Because females deciding to use it are more likely to continue this for a period of years rather than 1 year. This figure, Oh, here it is. Okay. So we have it. So E stands for estrogen. If you're taking estrogen only, and E plus P is estrogen plus progestin. So that's the E and the E plus P. So if you have still a uterus, thank you, Raging Ra. I should have looked at the chat. Of course the nest knows. If you still have a uterus, you need to have progesterone added to your estrogen therapy. So if you don't have a uterus, it's not necessary, but they call it unopposed estrogen, like estrogen by itself. It can kind of mess around with your endometrial lining. I don't know if you have breakthrough bleeding or something, but they always recommend to do progestin in with it if you do still have a uterus. So the risks and benefits. So this is after 5 years of use, and we have estrogen and progesterone for the colors. So the blue is estrogen only. So the benefits of risk of coronary heart disease increases quite a bit. Estrogen and progesterone together, 2.5. Are they just on different? How come I can't interpret this? Risks and benefits. Okay, so it looks like there is a little bit of a higher risk for some reason of coronary heart disease and invasive breast cancer. But if you have a uterus, you do need to have the progesterone also. They also have something called Premarin. That's something that is out there. Premarin, the name of this is a cream, and Premarin, Premarin, is pregnant mare urine, and that is how it's made. They keep horses pregnant and they collect the urine. So it's definitely not ethically sourced, and I would never go on Premarin for that reason. And at one time, I thought that that's really all that was available, but it's not. So the benefits for bone fractures, I mean, huge benefits. Because as our hormone production goes down, we have more risk of osteoporosis. Diabetes, it's a huge benefit. All-cause mortality, basically dying, it benefits us. Estrogen only could slightly increase the risk of hip fractures. If you're doing both estrogen and progestin, the benefits are more. All fractures, yep, lung cancer. So endometrial cancer doesn't seem to have an effect on it either way, which is interesting. And it can also stop maybe colorectal cancer. Deep vein thrombosis and pulmonary embolism, it does increase the risk slightly. Okay, Tiny Walnut, we'll catch you on the replay. Let us know how your date goes. Maybe we'll still be on when you come back. Who knows? So, and these people who do have, like, if you've ever had a blood clot, if you're a smoker, there's all kinds of reasons why someone cannot take menopausal hormone therapy or hormone replacement therapy, HRT. If you do have an increased risk of cardiovascular disease, it's usually not recommended. So not everyone can take it. Not everyone, but it definitely has some benefits. All right. So I'll tell you about my journey. A little bit about my journey. I got these ladies in the field. I'm going to put up a funny picture. Okay, don't take it seriously, please. Because that's an AI picture. You got a blood clot in your kidney? Oh my goodness. Well, that's a good one. Okay. Look at these ladies. I was like, I want it to represent the nest, but it doesn't. It doesn't at all. So they gave me frumpy dresses for some reason. And everyone looks like they're like, old, much older, and from like, oh, we're having a sorority reunion. And that was not what I was going for. Not at all. Not at all. But they gave us this pretty lady. I like this one a lot. But her eyes are all messed up because it's AI, So you're on the left, long blonde hair. Nice. I love this dress, though. But her eyes are wonky. Yeah. And this is probably one of the better ones. Like, looks a little more normal. This is not me, but this looks nothing like me at all. This is not me. Yep. Everyone should be able to choose if they want to take it as long as they know the risks, because no one cares about blood clots and lifestyle before you're not having potential babies. Yeah, I mean, it is a prescription, so you have to talk with your doctor and things like that. It's not something that you can just obtain over the counter. They do have things that look like it could be the real deal on Amazon with no prescription, but they're not. They're not the real deal at all. So, and then we got these ladies, a bunch of like blonde ladies. So this was giving us like all the ages. But I'm like, I don't want just a bunch of white women wearing prairie gowns. Like, this is not what I was looking for. But whatever. AI. Really. AI. Okay. So. I don't know. All right. Oh, yeah, I want to show you this too.
7 unusual...
It's coming. Oh, my God. What? 7 unusual symptoms. Yeah, that's pretty interesting. I'll show you that next. So I'll tell you a little bit about my journey. So a bunch of changes were happening. Like I said, and I talked to my doctor. She blew me off, I felt like. I was very disappointed in that because, you're supposed to be my source for this. I thought you would at least know more than I do. This is very disappointing. So this Winona thing. Now, there are lots of different companies. I am not selling Winona. That's not my goal here. I think just to have a discussion about like perimenopause, menopause, postmenopause in general, because no one really seems to talk about it. But I had asked the Nest, have you guys ever used this before? And maybe some of you have gotten ads for it, And I was getting the ads, and I clicked, and I was like, all right. I like that they do take a very thorough history. They want to know a lot of different things about you. And I was like, well, let me just go through the process. And, I don't have to actually like get the prescription. Maybe I can just find out more about it. Well, the more I was learning through it, I was like, I think I'm going to try it. To me, it's not very expensive, which shocked me because I thought not going through my doctor, not submitting it through insurance. You can pay for it on your health savings account, though, if you have one. And I'm like, this is probably going to be prohibitively expensive, And here's what we have, okay? So there's something called DHEA, and I did buy a bottle of it from Walmart like a week before I did this. And Walmart sells it like at 50 milligrams. They gave me 25 milligram capsules. You take one in the morning, and that's it. One in the morning. And DHEA is something that gradually reduces in your body over time. Starting at age 25, the level reduces little by little by little by little. And the DHEA is a precursor to your body creating estrogen to pumping out these hormones. So as the DHEA is lessening, it's not prompting your body to produce the hormones. So that's why that's added. And it's just like a tiny little capsule, 1 per day. And then, I was prescribed because they offer at Winona at least, and I haven't really looked into the other ones, but they offer an oral pill. You could take a pill. That was my first choice. So I was like, well, I'm really good about taking pills. I'm very good at it. So not to brag, I even wash my feet, believe it or not. I know. The self-care over here is off the chain. I'm taking my vitamins and I'm washing my feet. So I was like, well, I could take the pill. But they also have a patch. And the patch, I don't know much about it, but you stick it on. I think you change it out once a week maybe. But it's transdermal. So it absorbs through your skin and goes directly into your bloodstream. So that is an option. I went with a compounded cream. And I was like, and I have a pretty significant pharmacy background professionally. And I was like, I used to compound things myself. But I'm thinking hormones, I've never done that before. I've never compounded it myself. And I'm like, is that really effective, right? So I had a discussion with the Winona doctor because they, their default, I think, is to offer the cream. And I was like, I think I'd rather go with the pills because I really am good about taking pills. And she said, that's fine. Whichever you want to do is totally fine. Doesn't matter to us. And they explained, though, especially if you have any liver problems, I don't, thankfully, but if you do, if you take the pill, any kind of medication you take is going to be excreted or processed through either the kidney or the liver. I took black cohosh for like a year, P-Day, 2-Day, and it didn't help me at all. Not at all. But if it helps, then yeah. I've also heard evening primrose oil can help. So maybe like if you're at the very beginning stages, like if you're 35, it would probably help. It did nothing for me, but it absolutely could for somebody. So if you have liver problems, it's not the best option to take the oral hormones because it goes through your liver. They also have to prescribe a higher dose because it is being processed through, you swallow it, it goes through your digestive system, it gets excreted, the liver takes care of it, and then it distributes out to your bloodstream. If you're 35, get that yanked out? What? So the cream, it goes directly into your bloodstream. It bypasses all of that process. So the hormone level doesn't have to be as high because it's going directly in. And the same thing with the patch. So they sent me this little pump bottle, and what it is I'm taking, and I looked it up, and it's a legit prescription. So it's W-Biest, like B-I-E-S-T, which means that it has two types. It has estrogen, estradiol, and progesterone. And two pumps. It's in a nice little bottle. And I just squeeze it down, pump, and you rub it on the inside of your forearm, and that's it. I was doing it in the morning after my shower because I figured it would stay on my skin the longest if I did that. But they actually recommend that you do it around bedtime because the progesterone can have an effect that may make you a little bit I wasn't drowsy during the day, but I do feel more awake now that I've started doing it at night. So they recommend the forearm, and you alternate forearms because you don't want to keep using the same one, just in case if you have really sensitive skin, you might get a reaction over time. So I alternate. Sometimes I do it on my calves. So they suggest you do it in a place that has not much body fat. And if you look at your forearm, it doesn't, probably you can maybe even see your veins. So there's less skin, adipose tissue, all of that to get through to go into your bloodstream. And so that's what I do. I just do it on my forearms, and I take the DHEA in the morning. And that's it. And I'm going to tell you the difference that it has made. So they said 8 weeks, they're going to check in with me again after 10 weeks, but they have been checking in with me all along. And I get an email saying your Winona doctor, Dr. da-da-da, has a message for you. You go on and read it. You respond, you need to respond or at least acknowledge that you've seen the message from the doctor. And it takes maybe 12 hours or so for them to respond. It's not like a live chat. You send a message, they send a message. She answered all of my questions. I didn't feel like I was being I didn't feel like it was being dumbed down for me. She was talking to me like a regular, like we're peers. Not, if I'm using certain words, she's using certain words, And if, I liked that. I didn't feel like it was well, estrogen, da, da, da. You know what I mean? I don't know how to really describe it. I felt like we were two adults on the same level, because you don't always feel that way when healthcare professionals are teaching you something, sadly. So I expected after 8 weeks, okay, I should start to see some changes, right? I have been on it. Okay, started on August 7th. So it has been 3 weeks. 3 weeks. And I have noticed, noticeable differences. Okay. And I was just blown away because I was pretty skeptical, honestly. I'm well, I'll try it. I'll try it and see. I won't feel any difference at all. And maybe I just won't refill it after the 90 days because you get a 90-day supply. Well, telling you, 2 weeks in, the first thing I noticed, and these were subtle things, but I've been paying attention to my body and things. The first thing I noticed was that I didn't feel fatigued in the middle of the day. And I'm not talking about a lack of energy. I mean actual fatigue. I could lay down right now and take a nap. I was feeling that every day. And it was one day I'm I don't feel like I need a nap. And, I can't lay down every day, take a nap, but I would feel like I wanted to. That stopped. I was like, oh my God. And I'm like, well, maybe I'm just having a good day today, right? Just don't want to get off the couch. Right. But it kept on. And I did have a couple of days where I felt some fatigue. But since then, I'm fine. I'm going to tell you everything. So, you know how my ankle was hurting a little bit when I'd wake up in the morning? I noticed that, like, after 2 or 3 days, I said, oh, my ankle hasn't been stiff and sore in the morning. What? And I'm like, I don't know what I'm doing it different. And that's when I found out that perimenopause can actually, it can be a cause of joint pain. And I'm like, I've been dealing with that for a couple of years. I don't feel it anymore when I wake up. And the days that I do feel it, like there were days I just felt nothing. There was nothing there, no stiff, nothing. And like some mornings, it's a little bit, but nothing like it used to be at all. Crazy. Then I noticed how, I said that I was waking up 3 times a night to pee. It's only been like once a night lately, which is like huge because now I'm sleeping better. I'm not waking up every couple of hours to use the bathroom and not knowing, what I'm doing wrong because I didn't feel like I was drinking anything more. What else? Oh, this might be in my mind. This could be in my imagination. It really could. It really could. I felt like there were a couple of times where I caught myself in the mirror. Oh, there's another big one that I don't even know how I forgot this temporarily. But there were a couple of times that I'd catch myself in the mirror and think that my skin on my face looked a little bit younger. I didn't expect that. So decreased hormone production can result in decreased collagen production. So collagen in your skin, like Chantal takes her collagen, for her hair or whatever, right? Collagen production in your skin causes it to like plump up so you don't look like as, your wrinkles plump out a little bit. I noticed a difference on my face. You read all the books? You buy a copy of Estrogen Matters? Okay. Forgot to get your final workout for the weekend? Molly, I'm glad you got your workout in. Yeah. So, but I still think that could be all in my mind because that's like too good to be true, And I'm like, I don't look like 5 years younger or anything crazy like that. But it was a couple of times I looked and I'm like, it looks like I have been like doing some new skincare routine that is causing like a noticeable improvement. Like that's what it looked like. But I don't know. So I don't want to think necessarily. The hormone effect on skin is real, says Catsy. Trans people who take estrogen notice it instantly. That's crazy. The biggest thing. You've seen people say their hands are less wrinkly. I'll have to pay attention to that too. Wow. The biggest thing, okay? We were talking about the belly fat earlier, where it's like, I don't even, I'm not doing anything different. Like, what is this? What is this? I used to gain, around my hips and thighs a little bit. And, when I gained fat, that's where it would go. And it doesn't anymore. And I actually see like my belly protrude a little bit. And I've always had a fairly flat stomach, not abs or anything crazy, but like I could always wear things that showed off, like, I don't want to say showed off, but I never had a problem with my stomach or my waistline, basically is what I'm saying. Never. And then suddenly it seemed like, what is this that I'm dealing with now? And like I said, I felt like, well, I was mourning the loss of one of my dogs for the last year. I've had some things going on. I'm like, maybe I'm just not as aware of like, maybe I'm not active as I used to be, or maybe I am eating different things, because what else could it be, right? And my clothes were like a little bit uncomfortable too. Ugh, it's the worst. You know how like when you feel really, really bloated before you start your period? It was worse than that. Worse. So they say that a side effect of the hormone replacement therapy can be weight loss. And I'm like, well, I'm sure that's going to happen for other people, but not for me, because it's like too good to be true. I felt like one day after I go out for walks with my friend at lunchtime and everything, and I felt like my pants felt a little bit looser than normal. And I was like, oh, that's good. Maybe I'm just, I'm like attributing it all to myself. Like, oh, maybe, I'm just eating less and, I'm a little bit busier, right? So one morning I decide to get on the scale. I had weighed myself before I started this because I wanted to get a baseline. I'm like, okay, let me just get the cold, hard, ugly truth and let me just get on the scale. I've been avoiding it. Let me just get on. And it was as bad as I thought. Okay. So it was like, okay, all right. Yeah, I know there's an issue here. Well, I feel like, oh, my pants feel a little bit looser. I'm like, I wonder if I lost maybe like 4 or 5 pounds maybe. And I'm like, let me just weigh myself again. And not to check for weight loss, but just to like keep myself motivated. Like, let's get in a few more salads here. Let's get this going. Enough is enough, right? I got on the scale. I had lost 15 pounds. 15 pounds. I got off the scale and on the scale, off the scale and on the scale probably 6 times because I'm like, there's got to be something wrong with the scale. I was doing like a girl world on myself. Like the scale is lying to me. This can't be accurate. There's no way. And I had, I put a fresh battery in for my first weigh-in, so it's not even like an old thing. And I'm like, what? And I had written down the previous weight, so it's not like in my head. And, I have to do that so I don't, because my mind will mess with me about stuff like that. So I did have it written down. I got off and on, off and on, off and on. I'm like, I can't believe this. And I don't feel nearly as bloated. My stomach looks more normal. It still has a way to go, but it feels definitely more normal. It's just like, I can't, it blew me away. So and it's only been 3 weeks. I started it on August 7th. So like one day I came into the nest, with you guys, and I'm like, we were talking about it. Well, I took the plunge. I dove in and, it's going well, and people were like, well, what, But, people are here mostly for Chantal, and it's like, I don't want to bore people with my stories that, don't apply to them or whatever. But that's why I'm like, we should probably do a separate, like, little stream because there are a lot of ladies here who are approaching that time, are in that time, or past that time that we can all share our experiences and learn from each other. And I just really didn't expect all of that. I was skeptical, like this online thing. I'm like, well, all right, I'll do the 90 days and maybe I just won't refill it because I'm sure it's just whatever. It's not just whatever. Unbelievable. So I do have another little video for us. This is a different doctor. She talks about lesser known symptoms of perimenopause, 7 things to look out for. So, and these were things like they don't really talk about. So I'd like to play that for you as well. I know, Katsy, I did think you were very young. I didn't know, but now I know. Look at these Little House on the Prairie women with their prairie gowns. I'm like, you know what? I think the nest is a little more diverse than this AI. This is insulting. Please, give us something better than that. Okay. Yeah, keep taking it during menopause. Yeah, yep. Yeah, Kathy, same. Yep.
7 unusual symptoms of perimenopause. I'm Dr. Jen. double-boarded OBGYN and integrative medicine doctor. I help women every day navigate through perimenopause and menopause and live life to the fullest. Just start to feel like themselves again. So let's talk about some 7 unusual symptoms that could be perimenopause. So first, itchy ears. Itchiness all over actually can be a symptom of perimenopause, where you feel like your skin is just itchy and irritated and dry. And believe it or not, inner ear is a small space, and whenever you have the declining estrogen, you get drying of your tissues, which can lead to this sensation of itchy ears. 2, tinnitus or ringing in the ears. So ringing in the ears can be a lot of different causes. So you should always make sure you're evaluated for things like nutrient deficiencies or a viral infection, or various other medical conditions can actually cause ringing in ears. But if not, it could actually be a sign of perimenopause. 3,
Do any of you have the ear thing? Like, I thought, like, I wear earbuds at work, and like I would feel like I needed to like take out the earbud and itch inside, like scratch inside. You've been having tinnitus? Yeah. Jen Shah Hader, I am taking a hormone replacement therapy cream. So it's got estrogen, estradiol, and progesterone. And I'm doing it through this online pharmacy, and I was very skeptical, but I am seeing like actual changes. Yeah, and I'll tell you a little bit more about that. So any ear issues, you guys? I've definitely had a change in body odor. Like, it's a little bit different. Like, what? What is this? You know? Just a different type of odor.
changes in your body odor. Think about puberty, right? We go through puberty and suddenly things do not smell the same. These changes in our ovaries and our declining hormones actually precipitate changes in the microbiome, or the little bacteria that are present on our skin, in our mouth, in the vagina, in our gut. And when you change those microbiome, you can also change body odor. So you may notice that you're kind of having to change different deodorants, or you feel like you smell differently than you used to. Certainly, you can have vaginal odor that has appeared because, again, changes in microbiome can disrupt the odor that you notice. And estrogen is really, really critical for most microbiomes, especially the vaginal health as well as oral health and our gut health. So when we actually decline estrogen, or having decline in estrogen because of perimenopause, we notice changes in our odor. For migraines, so you can basically have no history of migraines and suddenly just start having these debilitating headaches, especially ones that you wake up with, or they're in the morning and kind of go away throughout the day. Migraines can actually get worse, both from declining estrogen and progesterone. Sometimes progesterone supplementation, like taking hormone replacement therapy, can actually give people migraines. So migraines are very much affected by hormones. And some women even have cyclic migraines, where they have migraines only starting luteal phase and through their period, but they actually don't have migraines other times. So migraines can be an often sign of perimenopause starting. Next, we actually have burning mouth.
I gotta say though, this looks like Chantal's throat. I gotta say though that I used to I used to have migraines. I found, I discovered my triggers, so I avoid those things. But since starting HRT, I have not had a migraine. And I think, so if you do currently have migraines, it potentially starting it could help alleviate them, or they could start, it sounds like. So yeah, definitely, we gotta keep in touch with our physicians, and because maybe it's like a dose change or a strength change that's needed.
Burning gums, basically oral health. Again, the microbiome changes because your hormones change. And so this can actually affect the amount of saliva that you produce. It can affect the nerves that are in the oral cavity. It can affect a lot of different aspects of the health of your oral health in general. Actually, women have more disease, dental disease, believe it or not, going through perimenopause, because again, the microbiome changes due to these hormones. And so you may experience now suddenly a cavity or this burning sensation in your mouth or your lips or your gums. all related to both declining estrogen because you're not making as much saliva, but also because the nerves are affected and the microbiome is affected. Next, we have joint pain. So often that is one of those signs that patients notice pretty early where they say, I wake up stiff. I wake up achy. Feel like there's like pain in my bones, like bone pain. And that is also both related to progesterone and estrogen. In fact, estrogen is so critical for bone turnover and bone health in general that when we go through perimenopause and start having especially those fluctuations in estrogen, which, that's part of those stages of perimenopause. So check out my video about stages of perimenopause if you want to learn more specifically about that. But joint pain is a common symptom of perimenopause. Next is heart palpitations. If you saw the little video on Oprah, that was actually one of her very first symptoms of perimenopause, is she started having these flutter sensations in her heart. She felt like she would just be resting and sitting and feel like her heart was racing, almost like she had too much coffee. And heart palpitations are very much affected by both estrogen and progesterone especially because we have receptors in our heart, and progesterone helps to calm the heart down. So when you actually go through perimenopause, you start noticing palpitations or these like uneasy feelings that your heart is racing. Now, there are other reasons for heart palpitations. Certainly at the age of being over 40, you should always make sure that you see a doctor to rule out any arrhythmias, but certainly palpitations can be benign and just related to hormone fluctuations. And lastly, I did want to mention, because though this isn't really sort of an unusual symptom, it's something that women often notice, and that's the changes in their weight and their metabolism, that suddenly they're actually having a harder time losing weight, and that everything they were doing from an exercise and nutrition standpoint is not getting where they want to be. So I will always put that in there because it's sometimes going to be a more subtle change that you notice that you're actually going into perimenopause and doing all the things right from nutrition, lifestyle, but it's not translating. And that's due to this insulin resistance and cortisol hormones that are intimately involved in sex hormones. So if you like this video, please like and subscribe and send me more topics you want to talk about related to perimenopause or just women's health in general. I love hearing about new video options and would love.
Thank you, doctor. I appreciate that. Thank you. And then I also just wanted to share with you Dr. Mary Claire Haver. She was on the Diary of a CEO, which is a wonderful channel if you've ever seen it, like amazing.
There is 20
and she's talking, so she talks about like she's considered the number one menopause doctor. They're lying to you about menopause is the title. So I'm just going to play a short part of this. I found this very interesting.
They were like, Mom, you've got the social media presence. You really need to use it for good. And that's kind of where that conversation exploded for me on social media, and where I realized by reading the comments what a much bigger what was really happening in the menopause world and how we need to bring it to the forefront.
For people that don't understand menopause, they might think it's a small issue affecting a small group of people. But how many women are affected currently by perimenopause, menopause, and postmenopause?
Sure. So right now, about a third of the female population of the world is in full or postmenopause. It's not optional. All of us go through it. And because we have such individual expressions of how it affects our bodies, what we know now is that there are estrogen receptors in every organ system of our body. And when those levels start declining, we see a very wide variety of a spectrum of syndrome, where it used to just be thought it was a few hot flashes and some night sweats. Maybe your sleep's disrupted. Your genital urinary system is going to take a hit. Your bones are going to get weaker. But what we know now is how much it's affecting our mental health, our capabilities, our skin, our bones, our kidneys, vertigo, tinnitus, frozen shoulder. Anytime I post about those on social media, the internet explodes. And women by the thousands are like, oh my God, I had no idea. And just the validation piece was so huge for them because they've been dismissed for so long and told it's all in their head.
And if we think about from sort of peri to postmenopause, what is that sort of typical, and I know that's a tricky word to use, but what is sort of average, typical age range? And then also, what is the sort of more possible age range? So it could start between this age and this age.
So in the US and in most of Europe, the average age of menopause, which means 1 year after your last menstrual period, is 51. Perimenopause, which is when your body recognizes there's some declining estrogen levels and you're beginning to be symptomatic, can start 7 to 10 years before that. So normal menopause is still 45 to 55. And so if you do the math and back that up 7 to 10 years, it is completely reasonable for a 35-year-old woman to begin to experience some of the symptoms of perimenopause.
So let's start with, what is it? And I would love you to explain this to me like I'm a 10-year-old.
Okay.
Because I'm sure there's a lot of people that are, both men and women, that aren't fully.
So we're going to talk about gonads, right?
What's gonads?
So gonads are so in men, it's the testes.
Okay.
And where you're making your genetic material to, where you're making sperm, right? And in a female, it's going to be ovaries. Her ovaries. So the big differences between male and female and how that process happens is that males make their genetic material fresh constantly the minute they go through puberty until basically they die, unless they have some medical issue. Females, on the other hand, our eggs develop while we're in utero in our mothers. So while we're in the womb, she's 5 months pregnant with us, we have our maximum eggs that we're ever going to have. And those are meant to last us until we go through menopause. And so they lay dormant until we go through puberty, and then they wake up again and we start ovulating. So we have this monthly in a healthy person, cyclical, hormones rise and ebb and flow with our cycles each month. We have a period, you get pregnant, you don't get pregnant, and the whole process starts over again. Well, because we're born with that egg supply, through time, we're decreasing the amount and the quality of those eggs. So when a woman hits the age of 30, she is down to about 10% of the egg supply that she had at birth. And when she's 40, it's down to about 3%. And it gets harder and harder for that ebb and flow of the natural hormones to do its job. And we start seeing fluctuations in her periods and then organ systems that are beginning to notice the lack of estrogen. Estrogen is a really powerful anti-inflammatory hormone in most of our body systems. So the musculoskeletal syndrome of menopause is really starting to be talked about quite a bit now. And we're looking at things like frozen shoulder, arthralgias, generalized aches and pains, and most physicians aren't aware of this. Most know about hot flashes and night sweats and sleep disruption, but now that we're really opening the conversation as to how many organ systems are affected, we are seeing people coming out of the woodwork just so happy to know that they're not crazy and they're being validated.
And what's happening at these sort of 3 stages? So we have the perimenopausal stage, which is, from what I've understood there, when estrogen levels start to drop.
Right. So we start seeing...
We're not crazy. We're not crazy. So this whole video, everything that I've shown you today is linked in the description, and I'll pin it to the comments too. So it's like you can find it very easily. And let's show you one more thing. And then we're about done. And then we can talk a little bit about our own experiences. So, and this is like ever since I started this, literally 3 weeks ago, I can't believe how Chantal did not take advantage of it. Like, it could help so much. You were prescribed antidepressant for hot flashes, cahoots? Good. Good. Yeah, whatever alleviates. Yeah. That's awesome, Green Dragon. Yeah, I'm glad. And a lot of the nests were all at different stages, and everyone has something important to contribute, I think. So this is, again, this is the pharmacy that I use. I'm not, there are different ones, but this is just what they sent a link to me for this to download. And the link to this is also in the description. It's 78 pages. So what can I do about the drop in hormone levels? At Winona, we encourage you to live your very best life. When it comes to menopause symptoms, refuse to endure it or suck it up. Why should you? Agree. Surveys of thousands of women in menopause transition show that they felt more optimistic about their life and aging after receiving treatment for their menopause symptoms than they did 10 years before. These women experience more hope, increased happiness with their bodies, newfound optimism about their careers, and are excited about their families. The compounded estrogen, progesterone, and testosterone worked brilliantly. This is looks like a testimonial. Within 4 days, my hot flashes and palpitations disappeared forever, my memory returned, and unexpectedly my mood lifted and my joints became supple. Estrogen was the oil I needed in my engine. I just wish my GP, my general practitioner, or my primary care physician, had told me about bioidentical HRT in the first place, hormone replacement therapy. So this is bioidentical. They don't use the pregnant horse urine or Premarin. They don't prescribe that. So this is bioidentical. See, this is what I wanted. AI, some diversity, some pretty, like middle-aged or a little bit older ladies. That's what I was looking for. God. It's not a disease. Yeah, we know. Signs of menopause will vary from woman to woman, but please do not ignore them. You are not alone. Safe, natural, bioidentical hormone replacement therapy is available at Winona if prescribed, because it's not for everybody. It's not for everybody. So they go into all the symptoms. There is a link in the description to download this. It's just a PDF file. We're only on page 15. There's 78 pages here that go through every single symptom. Vasomotor neural cold flashes, which not everyone knows about. Night sweats. I haven't had those yet. Tingling, dizziness, and vertigo. Weight gain. Let's read about this since we're all concerned about weight. We watch Foodie Beauty. Weight gain during menopause, especially around your middle, is often caused by the drop in the hormones estrogen, progesterone, and testosterone. By replacing the ever-decreasing hormones in combination with exercise and healthy diet, women can combat the accumulation of belly fat. Sometimes it's called the menopause belly. Oh my God. Reduced estrogen levels can lead to menopausal weight gain, lower quality sleep, decreased metabolism, lean muscle reduction. Researchers have linked low estrogen levels with an increase in the percentage of body fat, particularly abdominal fat or belly fat. Hormones control your metabolism, where you deposit fat, and the body's weight balance. The most effective way to get hormones back on track, halt the scale creep, and return to a healthy weight is to correct hormonal imbalances with the hormone replacement therapy. Once hormones are back in balance, weight loss can begin. And it goes on and on and on. Mental health, anxiety. A bunch of you mentioned that you've been more anxious. It's a mood-related symptom that some women experience. It may worsen at nighttime or only occur intermittently as hormone levels fluctuate. When estrogen level drops with peri and menopause, another hormone called cortisol increases. It's the stress hormone. Cortisol increases stress levels and anxiety. Anxiety affects 1 in 3 menopausal women and may contribute to panic attacks. Some women have never had a panic attack their whole life until they get a little bit older. Anxiety and depression are common symptoms of peri and menopause. Women seek help in many forms: excessive exercise, alcohol, and even denial. Winona believes that hormonal causes and correlations must be incorporated into any meaningful conversation about mental health. Fogginess, concentration difficulties. I'm at that point where I go into a room and forget why I'm in here. I'm like, what did I come in here for? Depression, memory lapses. Don't you hate that when you can't find a word? Panic attacks. That's just like the mental irritability. And then they go into like vaginal dryness, vaginal irritation, itching, decreased pubic hair, decreased labia. Skin. Oh, the skin. Because I've noticed a change in my skin for the better. Not drastic, but enough that I caught myself in the mirror like, am I just feeling good today that I have a good, like, a good attitude about what I'm seeing in the mirror? Or is there actually a change, you know? Yeah. So the link is in the description. Oh yeah, around 50, your skin doesn't hold as much water, leading to wrinkles because of decreased hormones. I mean, dry, wrinkly, itchy, aging skin, jowls, rashes or easily irritated skin, feeling clammy, changes in body odor, thin skin, rosacea, wounds healing more slowly, dark circles under the eyes, breast tenderness, age spots, oily skin, loss of breast fullness. It goes on and on and on and on. So, interesting, huh? I think so. There used to be studies that showed women had more attractive faces at certain times in their cycle and would make better tips. Interesting. Oh, tips. Oh, interesting. Huh. Saggy tits, yay. Yay! Loss of breast fullness? Woohoo! You did the estrogen, progesterone, and testosterone pellets for 2.5 years, Raging Raw. And how did you see like a difference? Like how did it help you? I wonder how much of this has affected your hospitalization, Abriana? Oh. I hope that's not the case for you, Molly. You don't know. You started estrogen treatment today? Wow, that's right on time. You were exhausted all day? Okay. I did have, because the doctor did tell me that, because I do already take an antidepressant, and she told me that the change in hormones could possibly like affect your mood a little bit in the beginning, but then it will even out. And I would say at the beginning of week 2, I did feel myself feeling a little more irritable and like thinking about my dog who passed last year more than usual. And thankfully, she had told me to expect that. So I didn't, I just like let it happen. I just felt the feelings. And it did go away probably after like 3 or 4 days. So that was the only adjustment time. And it wasn't horrible. Like I wasn't debilitated. I wasn't still in bed or crying all day or anything. But I did feel a difference. You're still moody AF, but it's day 1. Yeah. Allow a little more time. Yeah. Talk to your doctor about mental health. There's always options. Yes, Green Dragon, for sure. All you want to do is cry, Sabin Nation? Yeah, you should definitely look into something. This may or may not, help, but you gotta definitely talk to a doctor. The tea made me want the D daily. My husband went to from famine to feast. That's awesome. Oh. Yeah, the main thing is we don't have to suffer, That is the main thing. We don't have to suffer. So someone had asked about cost. So let me pull up. I did download like a receipt of sorts. Because you can submit it, you can pay for it if you have a health savings account. So that's nice. I don't have a health savings account, but I really thought it was going to be way more expensive than it is. All right. So these are for 90 days supplies. Let me get out my calculator. Okay. So I take the DHEA pills in the morning, and the cream, I actually put it on while that video was playing, 2 pumps, and rub it into the inside of my forearm, and that's it. That's all I have to do. It's even the capsule's tiny. All right, so the total. Okay, for a 90-day supply, the cream and the DHEA was $184.50, which is $61.50 a month. And like I said, you can pay for it with your HSA. It is an eligible medical expense under the IRS code 213D. Yeah, I thought it was going to be like over $100 a month. So $184.50 for 90-day supply. And the doctor has checked in with me several times just to see how things are going, if I had any more questions she could answer, like way more than my regular physician has ever reached out to me about anything, you know? So I was impressed with that. And I've only been on it for 3 weeks, and I'm just like, whoa, amazing. That's 213D, ladies. Ms. Mac, what are you trying to say? For those in Canada, the provincial drug benefit covers some treatments. Nice. Yeah, HSA for the States. Everywhere else, yeah. You had 2 male doctors. They spent an hour with you. That's awesome. That's really good. Woo. Now, there are other websites. I haven't really checked them out, but I have seen them. But I can tell you my experience with Winona has been great. And if you do want to look into it with Winona, I did put a link for $50 off. So if you do want to check it out, you know, just use that link in the description. You'll get $50 off. It's like a referral link. You were in a serious state. Had many infections, had 8 to 10 IVs in my arm at once, had DKA and the sepsis, which according to the doctors would have killed me if I hadn't gone to the hospital that day. Unbelievable, Brianna. That's awful. You wanted a partial hysterectomy because your periods were so painful, Blue Eyes, and heavy, but the doctor wouldn't do it. A nurse told me to tell the doctor I had pain during sex and that would give me a hysterectomy. Really? Interesting. I appreciate that, Ms. Mac. Ms. Mac is Canadian, just being helpful for those taking notes. I appreciate that. Thank you. Yeah, healthcare is so different all around the world, truly. Yep. You got 2 Ds, but they ain't 18. Oh my God. Did anyone have to answer questions about their family history before getting prescribed? I did. It's like, I want to live for another year, so I have no answers to your screening questions. Oh. Yeah, they did a pretty thorough questionnaire about everything. ICU for 10 to 12 days, hospitalized for 2 months, PT rehab another month, vertigo so bad your vision goes black and you pass out. What was the actual cause of that, Brianna? Was it DKA? You know, because if it affects a man, then take care of it. Never mind my pain. Right, Blue Eyes? Right. Yep. You didn't want a period after you were done with kids, so I asked my doctor for an ablation. Best thing I ever did till now, and they ask about my periods. Nice. So I'm glad that worked for you. I had an ablation in 2017. I still get a very regular period. Regular in every way, sadly. But I got the ablation for a different reason, so... You actually got prescribed for semaglutide, aka Ozempic, for your PCOS. There's so much disinfo about it, but it regulated my period and was so helpful, but my insurance stopped covering it. Oh, Prismo. That stinks. Oh, I see, Ketsy. You don't know specifically what your mom died from. Okay. Totally true, Saban Nation. There's not enough doctors properly trained in women's health, probably men's too. It angers me when my male PCP says, oh, I understand. Yeah. Yep. And it's shocking how many women physicians aren't educated on it either. I mean, I really feel like I'm an advocate for myself, you know, in the health field, like, you know, medical stuff. Like, I don't just accept an answer. Like, I will advocate for myself. And I was just really like, how do I even find a doctor who knows about this that I can talk to on a real level. It was so discouraging. You know, for me to have to like, okay, I guess I'm going to go online. It really felt like you guys have really let me down, my providers. You guys have really look what I'm doing. You know? But you do what's best for you. And like I'm just so glad I started it. I truly am like blown away. I was like, well, maybe at the 8 to 10 week mark, I'll start to see a little change. You were surprised with how much cancer in your family, and they did a questionnaire, and it said being on estrogen would only put me in the 1.7% to get cancer. Okay, that's very interesting. Yeah. Yeah, if you're at a certain risk for cardiovascular disease, HRT isn't an option. There's like a calculator that they use that includes your cholesterol levels, your weight, your age, all that stuff. You thought you were going to be judged hardcore for taking semaglutide because of all the disinfo about it and judgment? No, of course not. Prismo, we're the nest. We're the nest, okay? Even if you were taking it for weight loss, we wouldn't judge you. Like, anyone who's trying to improve their health, please, there's no judgment for that. I'm glad you did your own thing back when I was still thought of as young. I knew you'd get your needs considered. Yeah. Thank you, Catsy. Yeah, there's no judgment on that at all. Who cares? Yeah, they do ask about the cancer. Yep. Yeah, I was blown away with the scale. I'm like, I know my clothes are fitting better. I thought maybe 4 or 5 pounds, maybe, but believe it or not, insurance companies are making it hard for people with type 2 diabetes to get it too. Really? Even your doctor was very disappointed. That's terrible. Like, what is the problem? When I saw something, I was worried. It was cancer. My male doctor was very supportive, even though he seriously doubted that was it. He even offered an early mammogram. Good. Sometimes your peace of mind, like, okay, so maybe clinically I don't fit all the check marks, but can we just take a look anyway, Oh, okay, Kathy. Thank you, Kathy. We interrupt this very educational stream to mention that Foodie is apparently live again. Okay, well then, let's end this stream. We'll keep it separate from her, and I'll start a new one. Okay, everybody, thank you so much for coming. A lot more people showed up than I expected, honestly. And, yeah, check the description for all those links. Everything is there. Everything. And I'll see you on the new stream. Keep an eye out for it. I'm gonna do some sniping. Okay, I'll see you in a bit.